Yo, hi, I am Jever, and I'll be reporting about the topic Reproductive Health Act of the Lecture 29. Just a disclaimer, this is actually a PDF file, so you will see me, you can't see me though, you will, see the PDF being scrolled by me, because this is not a PPT, and sorry for the noises in the background, it's my AC. So let's talk about the Reproductive Health Act of 2012. It's also known as the RH Law. It's actually a groundbreaking law, which means groundbreaking, it's a big change. And also, it guarantees universal and free access to nearly all modern contraceptives. Of course, we know contraceptives, those are the methods and also the objects that we use for us to be able to stop reproduction, and it is all available for the citizens if this law will be passed on, including the impoverished communities, which are the poor communities at government health centers. So if these poor people are willing to undergo contraception, well, they can go to the health centers for them to be able to get the contraceptives that are available, depending on the availability of those. So the law also mandates reproductive health education in government schools and recognizes a woman's right to post-abortion care as part of the right to reproductive health care. With that being said, actually RH law is really pro-women, which means the people who benefits the most of this topic or this law will be the women. So let's continue. The Responsible Parenthood and Reproductive Health Act of 2012, also known as the RH Law, and officially designated as Reproductive Act number 10354, is a law in the Philippines which we know guarantees universal access to, of course, the methods of contraception, fertility control, sexual education, and maternal care. Of course, we know that our country is part of the third world countries, and it's not going to be easy, especially if you are poor and you're going to have more children. How are you going to feed them? So this is on the pro side of it, will give us a big change in our mentality or mindset to stop giving birth, especially if we cannot afford to to keep up with the lifestyle that we want our children to have, especially if we cannot support them in the future. Let's continue. Who actually is this? This is Nancy Northup. She's a president and CEO at the Center for Reproductive Rights. Let's try to read what she said. She said the reproductive health law is a historic step forward for all women in the Philippines, empowering them to make their own decisions about their health and families and participate more fully and equally in their society. Of course, women are the ones giving birth, right? It's not easy to give birth. It's like life and death situation at the moment. Also, the process of even the process, the 9 months, not the 9 month long process would give the women a very not easy experience. Of course, you're carrying a child, and they're very fragile. You have to make your lifestyle healthy. Your movement should be not that what do you call it, clumsy, and this will give the women a right for them to express themselves about what they want, if they really want to bear a child, and also for them to know when to stop if they want to. So let's continue. Here we're going to talk about the former president Benigno S. Aquino III, also known as Ninoy Aquino. He's the one who signed the RH law in December 21, 2012, which was, of course, we are part of we are a country, which is very religious. We are a Christian country at most. So this RH law was immediately challenged in court by various conservative Catholic groups. On March 19, the Supreme Court issued a status quo anti-order for 120 days that was later extended indefinitely, halting or slowing the process of the RH law from going into effect. 14 petitions, well, that's a lot, questioning the constitutionality of the law on the grounds that it violated a range of rights, including freedom of religion and speech, were consolidated for oral arguments that began for July to August 2013, and that would be like a month of arguments, right? Which is long, of course. So that's it. So here, Supreme Court struck down a number of provisions in the RH law. Healthcare providers will be able to deny reproductive health services to patients based on their personal or religious beliefs in non-emergency situations. So that happens actually, that is happening actually right now in hospitals. I know somebody who works in GTLMH, our public hospital in Iligan City. So the person actually that he, I mean, my friend who is a nurse encountered a patient who has a different religious belief, and I would not want to to go into details, but they avoided something that should be done just because the different belief and also the different religion of the patient. So they actually tried to just agree and compromised with it. So next, spousal consent for women in non-life threatening circumstances will be required to access reproductive health care. Parental consent will also be required for minors seeking medical attention who have been pregnant or had a miscarriage. Petitioners in the case will now have 15 days to appeal the Supreme Court decision. So that's it. So next, here it says, while it's concerning that certain provisions in the reproductive health law were struck down, the Supreme Court has put women first, and now the benefits of this law can finally become a reality for millions of Filipinos, said Melissa Apreti, Regional Director for Asia at the Center. Women have waited long enough for the reproductive health services and information they deserve, and the government must now move quickly to implement all the necessary policies and programs without delay. So of course, RH law is actually a great idea, but of course, it surpasses and also quite if you're going to be part of this, if you're going to do this, you would also crash a bit of the religious belief that you have, especially if you're a really religious person. For some religious person, they're very close-minded to this. So what do you think, guys? Do you think it is a good idea to get or to have RH law? Is it good to use contraceptives? Well, I don't have actually a pro or a bias about this. So let me know if you have. That's all. Thank you.